Imagine waking up and already feeling that familiar warning sign, a tightness behind one eye, a heaviness in your head, and that quiet fear. Is another migraine coming today? For many people, migraine is not just a headache. It steals time, energy, workdays, family moments, and peace of mind. In the previous video, we discussed the medicines used to treat migraine attacks when they happen. In today's video, we are talking about something equally important: medicines used to prevent migraine attacks from happening in the first place. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. What does migraine prevention mean? Not everyone with migraine needs daily medicine. But for people with very frequent or very severe migraines, taking a medicine every day can reduce how often attacks happen and how bad they feel when they do occur. Prevention does not usually mean migraines disappear completely. It means fewer attacks, less severe pain, and a better quality of life. Who should consider preventive medicine? There is no single rule that fits everyone, but you may want to think about preventive treatment if you have more than 2 migraine attacks per month and they significantly disrupt your life, or your migraines are less frequent, but when they happen, they are severe and disabling, or you need to use painkillers or triptan medicines very often, or painkillers or triptans are not working well, or you cannot take them because of side effects. Some people develop headaches because of overusing pain medicines. This is called medication-induced headache. And some women have migraines that are closely linked to their periods. This is called menstrual migraine. In all these situations, prevention may be worth discussing. Why a migraine diary is important. Before starting preventive treatment, it is very helpful to keep a migraine diary for a few months. Write down how often migraines occur, how severe they are, and which medicines you take during attacks. This helps you and your doctor understand whether prevention is needed and whether medication overuse may be part of the problem. It also helps track whether a preventive medicine is truly working. Medicines used to prevent migraine guidelines in the UK have been updated, especially regarding safety in pregnancy. This is very important for women who are sexually active and could become pregnant. Important pregnancy-related safety points. Sodium valproate should not be used to prevent migraine. If topiramate is offered, you must understand a few things. Topiramate can reduce the frequency and severity of migraines, but if taken during pregnancy, it can cause birth defects. It can also reduce the effectiveness of hormonal contraception. Very reliable contraception is essential when using topiramate. Never start or stop these medicines without specialist advice. Beta blockers. Beta blockers include propranolol, atenolol, metoprolol, timolol, and nadolol. They are commonly used for high blood pressure and heart conditions. By chance, doctors noticed that some people taking propranolol had fewer migraine attacks. Propranolol is now one of the most commonly used medicines for migraine prevention. Treatment usually starts with a low dose, and the dose can be increased if needed. However, beta blockers are not suitable for everyone. For example, some people with asthma cannot take them. Anticonvulsants. Sodium valproate and topiramate belong to this group. They are mainly used for epilepsy, but they can also prevent migraine attacks. As mentioned earlier, sodium valproate is not recommended for migraine prevention under current guidelines. Topiramate may be used in selected patients with strict safety precautions. Amitriptyline. Amitriptyline is a tricyclic antidepressant, but its migraine-preventing effect is separate from its antidepressant action. It is started at a very low dose and increased slowly if needed. It is not suitable for people with certain heart conditions, arrhythmia, or epilepsy. Although it is not officially licensed for migraine prevention, it is widely used in real-world practice. Flunarizine. Flunarizine is a calcium channel blocker. It is commonly used for migraine prevention in many countries. However, it is not licensed or routinely available in the UK. In selected cases, a headache specialist may arrange access. Gepants and CGRP inhibitors. These are newer migraine preventive medicines. Rimegepant and atogepant belong to a group called Gepants. They work by blocking CGRP, a key chemical involved in migraine. They are usually prescribed only after at least 3 other preventive medicines have failed. CGRP monoclonal antibodies. These medicines also target CGRP. They are given as injections. Options include galcanezumab, fremanezumab, eptinezumab, and erenumab. They are available on the NHS only when other preventive treatments have not worked, and they are started by headache specialists. Other medicines. If standard options fail, a specialist may sometimes try other medicines such as pizodifin, gabapentin, calcium channel blockers, lisinopril, or selective serotonin reuptake inhibitors. These are used carefully, as evidence may be limited or side effects significant. Important things to know about preventive medicines. These medicines must be taken every day. They usually reduce the number and severity of migraines, but may not stop them completely. It can take 1 to 3 months to see the full benefit. Preventive medicines are often tried for 4 to 6 months, then stopped to see if they are still needed. If a migraine attack happens, you can still take painkillers or a triptan. If one preventive medicine does not help, another can be tried. Always read the information leaflet for possible side effects. Menstrual migraine prevention. The medicines used are similar to other migraine prevention treatments. Sometimes additional strategies are used around the menstrual cycle. This is planned individually with your doctor. Botulinum toxin injections for chronic migraine. For people with chronic migraine, Botox injections may be an option. Chronic migraine means headaches on at least 15 days per month, with migraine on at least 8 of those days. Injections are given every 12 weeks into specific muscles of the head and neck. This treatment is only offered after at least 3 preventive medicines have failed. It must be given by trained specialists and is very different from cosmetic Botox. Final thought. Migraine can feel overwhelming, but prevention can change the story. With the right medicine, the right guidance and patience, many people regain control of their lives. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes, and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.